When am I going to feel this baby move? That is such a normal thing to be thinking. It is one of the most magical parts of pregnancy, the idea that this baby is actually growing inside of you and moving. And yes, I've got to tell you, as a labor and delivery nurse, sometimes when you go to check a patient, the hand grabs you, and every single time I think something's alive in there. Well, of course something's alive in there. It's just hard to wrap your mind around all of it. But baby moving inside shows you that everything's going well. So when should it happen? And this information comes from my 20 years in labor and delivery, along with talking to millions of people online, plus what the data shows about when people feel baby move. Now, this is information that you might not want to hear, but most people, especially first-time parents, don't feel baby move until they're close to 20 weeks of pregnancy. That is for a variety of reasons. You don't exactly know what you're feeling for. A lot of times it can feel like gas or flutters that don't really feel like you're picturing baby will feel in your womb. And so by the time they're about 20 weeks, their movements start to get big enough that you're like, oh, I think that's baby moving. Now, if this is your pelvis, a lot of people are surprised that they feel baby moving just right in their lower abdomen. They don't feel it kind of where we imagine baby might be kicking. But at 20 weeks of pregnancy, you've got, this little action figure here. Hopefully it's not Zelda with a sword versus a big baby in there. So it's really just different. And you're really going to feel those movements in your lower abdominal segment versus like higher up. So you're looking belly button below. That's where you're going to feel baby moving first off. By the way, is anyone naming their baby Zelda? Tell me down in the comments, because this is the only action figure I could find in my house. I hope your baby doesn't have a sword. Now, a lot of times people call this quickening. That's when they feel the baby start to move, and it's the big sign that there is a baby in there. You got to think back in the day, they would just miss a period and they would start to have some of the signs like tender boobs or throwing up. And they didn't really know they were pregnant. There was no pregnancy tests back then. And so quickening was one of the biggest signs that, yes, I am pregnant. I felt baby move in there. There is a baby in there, which is really different for us because, we have tests at the dollar store, and most of us are seeing the baby on the ultrasound pretty soon after we make an appointment with our provider. Now, when are you going to feel your baby move? I want to tell you that there's a few things that are either to your advantage or your disadvantage as you're trying to feel baby move. The first one is really where this placenta is. If it's on the front, which is an anterior placenta, it may blunt some of baby's movements that they're trying to make towards you. And so you just don't feel it as much. You kind of think of it as a little cushion that would make it so it's harder to feel baby move. Now, this doesn't mean you're not going to feel baby move. It just can be a little bit harder, and it might be why you don't feel baby move until a little bit later. Now, beyond the placenta, it can be how baby's lying. If they're just in here and their feet are kicking up at kind of like nothing up in here, that's really different than if they're here and they're kicking, right in front of your belly, and you would feel a little bit more. So it really depends on how baby is laying. Also, baby's movement routines. Just like all of us, some babies move more and some babies move less. Doesn't mean that one is healthier than the other. It's just how they are. And also how attuned you are to it. This is why second-time moms tend to feel baby a little bit earlier, because they know what they are feeling. And I am here as a person who is not pregnant, but every once in a while I'll have gas and I'll be like, is that the baby moving? It's not the baby moving, it's gas. It can be really hard to differentiate between the two in the beginning. And then just your abdomen. Some people say that people who have more adipose tissue or a little bit fluffier, like the pregnancy nurse, they might feel baby move a little bit later than those who don't have adipose tissue. But again, it's a lot about the musculature, where baby's lying, where the placenta is. That is why you feel baby move when you do. The average time that people feel baby to move is about 16 to 22 weeks of pregnancy, which if you translate that to months, it's like about 5 months of pregnancy. So a little bit more than halfway through. Now, if you're getting to that point and you haven't felt baby move, I think it's worth it mentioning to your provider, especially if you're past 20 weeks and you're not feeling baby move. Definitely mention it with your provider, although you should be getting an anatomy ultrasound at around 20 weeks. That should reassure things as well. Now, this brings us to one of the most important things for the pregnancy nurse, and that is kick counts. Now, they start at about 27 weeks of pregnancy. I have a whole cheat sheet on kick counts because fetal movement is your best indicator of fetal well-being. And I got to tell you, there's a lot of providers out there who tell you how to do them incorrectly. So grab my cheat sheet so that you're making sure that you're doing them based on you, this pregnancy, this baby, and knowing that this baby is doing okay. And I actually get the question a lot online. Is there a normal amount of fetal movement? And I'm here to tell you no. Everyone is different. It depends on all those different things. Where the placenta is, where the baby is, just we call it your habitus, just how your body in your abdomen is positioned. All of those things will affect how you're feeling baby move. And then every baby's different. Some are just wild and crazy, and some are a little bit more timid. So the big question is, and you can answer this down in the comments, if you've had a baby that was wild and a baby that was a little more timid, did that happen outside of the womb? Did you see that their movement pattern correlated to how they were when you were pregnant with them? Of course, knowing what's normal is important. I recommend a birth class. I'm going to link it down below, but it can really help you to start to know what's normal during third trimester all the way through birth and postpartum. And I don't know how far along you are, but I actually have a pregnancy month-by-month timeline that you guys can pick right where you are and find out what you should be doing depending on which month of pregnancy you're in. I'm going to link it up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.